Good day everyone. This is a video regarding a cerebral angiography case. In this video, there are three characters. The first character is Miss Lim, who is a radiographer. The second character is Mr. Tan Ah Yong, who is a patient. The third character is Dr. Kim, who is a radiologist. For this case, Mr. Tan is a 30-years-old Chinese male presented with symptoms such as headache, seizure, vertigo, ataxia, and mental disturbance. Mr. Tan has the history with ischemia, shock, and epilepsy. The indication for cerebral angiography is developmental venous anomaly DVA of the brain.
Good morning, are you Mr. Tan Ah Yong?
Yes, I am.
Okay, Mr. Tan, I believe that you know today you are going to have an angiography examination on your brain. So, now I will ask you a few questions to ensure that you have well prepared for the examination. Firstly, have you done fasting for 6 hours?
Yes, I have followed your staff's instruction to stop eating 6 hours before the examination.
Okay, Mr. Tan. Do you have any allergy or asthma?
No.
Do you have any heart problems?
No.
Later, referring to the blood test result which have been done to Mr. Tan 2 days ago.
So, referring to your blood test result, it showed that your renal system is in a good function and your blood clotting indicator is also in a normal range. So, you are well prepared for the procedure. Now, I will explain the procedure for you so you can mentally prepare for it first. So, later in the examination room, you will be transferred to the table couch. When the procedure starts, doctor will apply a local anesthesia at your groin area to ease any discomfort at that area. He will use a needle to puncture at your femoral area. Then, a small tube called catheter will be inserted into your artery called femoral artery. You will feel some pressure when the catheter is being placed. Doctor will then advance the tube to the vessel of the head and neck. Then, an imaging equipment which uses X-ray will be used to help doctor guide the tube into the vessel which they want to see. So, when it is the time to take the images of blood vessel, doctor will inject medicine, contrast, into your vessel through the tube. You will feel warm but not painful that lasts for a few seconds when the medicine is injected. The imaging equipment will rotate around your head. You may also hear beeping noises as the pictures are taken. So you cannot move at all during the procedure yet.
After doctor obtained the consent from the patient was then sent to the angiography room. Before the procedure started, the first job done by Lim was to prepare the angiography room. When the patient arrived, Lim helped in transferring the patient to the patient couch. Then, Lim helped in monitoring the blood pressure, oxygen, and ECG of patient body. After that, Lim ensured that all personnel in the room have donned on the leg gown and tie rod shirt. And the procedure started. After doctor punctured patient gluing lesion by salvaging the teeth, Lim took the X-ray images by following the insertion pathway of the dead wire. After locating the catheter, and before the contrast was given,
Lim, can you position the patient in AP town view position?
Okay, doctor, please check.
Lim, can you position the patient in lateral position?
Okay, doctor, please check.
after whole procedure was done, the doctor compressed on the puncture site for 15 minutes.
So, Mr. Tan, the whole procedure is done. So, you need to be on bed for 4 hours in semi-Fowler position. Is there anybody drive you home after this?
Yes. My wife will drive me back.
Cerebral angiography is a study of common carotid artery, external carotid artery and internal carotid artery and vertebral artery of the brain. There are mainly 3 vessel cerebral angiography. Below shows the pathway of visualizing blood vessel at right anterior and middle cerebral artery which focus on right hemisphere of brain only. The second pathway is to visualize the cerebral blood vessel at the left anterior and middle cerebral artery which focus on the left hemisphere of brain only. The third pathway is to visualize the whole circle of Willis through either left or right vertebral artery as they are connected to basilar artery. For each pathway, images were taken in mainly an AP-town view and lateral view projection. Sometimes, oblique view is also taken. So basically, 6 view of images will be taken. Additional images are also taken based on doctor's request. These are the examples images for visualizing right cerebral artery which include the right anterior cerebral artery, right middle cerebral artery and right lateral cerebral artery in AP view and lateral view. These are the examples images for visualizing left cerebral artery which include the left anterior cerebral artery, left middle cerebral artery and left lateral cerebral artery in AP view and lateral view. These are the examples images for visualizing circle of Willis and posterior cerebral artery in AP view and lateral view.
Hey Lim, this patient is suspected with DVA. Can you tell me what you know about DVA?
Developmental venous anomaly, DVA, also known as cerebral venous angioma, is a congenital malformation of veins which drain normal brain. They were thought to be rare before cross-sectional imaging but are now recognized as being the most common cerebral vascular malformation, accounting for 55% of all such lesions.
Do you know why we need venous phase for this patient?
It is because since this patient was suspected from DVA, arterial phase appears normal although late capillary blush may be present. No shunting is present. Angiographically the caput medusae appearance, collection of dilated medullary veins converge in an enlarged transcortical or subependymal collector vein, is pathognomonic and seen only in the venous phase, unless arterialized DVA. Besides, we use venous phase as this can further confirm initial diagnosis from CT or MRI.
Do you know how we achieve the venous phase during the procedure?
The transit time of contrast from arteries to arterioles to capillaries to venules to veins of the brain depends on the patient's blood pressure, cardiac output, intracranial pressure, and any mechanical impedance to contrast flow. Generally, it takes about 4 seconds for the dye to move from arteries to veins. Thus, contrast injection duration of 1 to 2 seconds allows for adequate separation of arterial and venous phases, so that by the time dye reaches the veins, there is no longer contrast still present in the arteries to confuse the picture.
Can you tell me what the appearance of DVA in venous phase is?
Selective right internal carotid angiography showed no abnormality in the arterial phase. However, in the venous phase, dilated deep medullary veins were noted widely distributed in his right frontotemporoparietal lobes. ADVA is characterized by the caput medusae sign of veins draining into a single larger collecting vein, which in turn drains into either a dural sinus or into a deep ependymal vein. The appearance has also been likened to a palm tree.
Great. It seems that you really understand the whole procedure in DVA. Keep it up.
Thank you, Doctor. These are the examples images for DVA. The first image shows the palm tree sign in venous phase. The second image shows the caput medusae in venous phase.